I can see your screen. Okay, now. Wait 1 second.
Mhm.
Where is the past? Oh, okay. Question 6. A prospective cohort study was conducted. A prospective cohort study was conducted to evaluate. Can you hear me clearly?
Yes.
Okay. A prospective cohort study conducted to evaluate the long-term effect of a high-fat diet on the incidence of colon cancer. The study participants were randomly selected from the population of interest. Dietary patterns were assessed through the use of the periodic completed questionnaires, and the investigators reported a 5-year relative risk of a 1.60 people who consumed a high-fat diet compared to the individual who consumed a low-fat diet. The 95% interval was 1.2 to 2.15. The study is most likely to have each of the following values. They are looking for the p-value.
Mhm.
P-value. Power equal to 1 minus alpha, isn't it?
One minus beta, you mean?
Sorry, 1 minus.
Beta.
Okay, sorry. I told totally opposite. So how we can find the beta?
Why are you trying to find the beta? They're asking you which of the following. They're asking you. What are they asking you?
They are asking for p-values
So why are you trying to find beta? I don't understand.
to find out the power.
Why are you trying to find the power?
Okay, p-value. Okay,
What is there a relationship between p-values and power? I don't understand.
I thought, but okay, I'm thinking opposite.
Okay.
Okay,
Okay.
so how we should proceed?
Okay. Can you eliminate something?
I am not getting any clue how to,
You're not getting it. Okay.
like
Okay. Okay.
it is case control. Oh, sorry, cohort. That means
Mm-hmm.
it's a cohort
Mm-hmm.
study, so relative risk
Mm-hmm.
1.60, and
Mm-hmm.
they have given the confidence interval 1 point.
Okay. They have given you something. Can you do something with the relative risk and the confidence interval? Can you do something with
That's
it?
the thing I am looking for.
Okay.
Okay, you tell me what to do.
No, you say that's the thing you're looking for. I thought you wanted. Okay. 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 So they are giving you the relative risk and the confidence interval. What's the first thing you usually do? You check if it's statistically significant, right? Usually when
Yes,
they give you
yes.
okay. So can you tell me something about it? Is it
It is
statistic?
uh, it is statistically significant as
Okay.
the relative risk falls into the confidence interval category,
Mm-hmm. And
and usually the p-value should be 0.05 or less than 0.05, isn't it? So is the
okay.
question A is the answer.
Okay, okay. You think it's A.
Yes.
Okay, because can you repeat it again?
Yes,
Mhm.
because as the relative risk falls into the confidence interval, within the confidence interval, and usually if the thing falls in within the confidence interval, then we found that p-value should be less than 0.05.
Okay. So just to add something, yes, it falls inside the confidence interval,
Yes,
but also the confidence interval doesn't include one.
one,
Because
yes,
even if this fell inside and it included one, then it would not be statistically significant.
significant, yes.
Okay. Okay, let's check. Oh my God. A, you are right. It's one. It's A, sorry, it's A. You can read the explanation.
In general, for study result to be statistically significant, the 95% confidence interval must not contain the null value. This is equivalent to p less than 0.05, which means that there is less than 5% chance that the results are due to chance alone. In this case, 95% confidence interval 1.02 to 2.15 and does not contain the null value 1. This corresponds to p less than 0.05. Thus, 0.04 is only correct answer. And
Okay.
the BCD option p values are more than 0.05, meaning the associated 95% confidence interval would contain the null value. Confidence interval and p-values are interrelated and express the statistical significance of a study. In a statistically significant study, p should be less than 0.05. The corresponds This corresponds to a 95% confidence interval that doesn't include the null value.
Okay.
Okay?
Does it make sense?
Yes, makes sense.
Oh, perfect. Next.
So this is the box. Okay, I'm
Um,
reading the box. Factor affecting the power. If sample size decreases, power decreases. More difficult to detect effect. If sample size increases, power increases. Easier to detect effect. Variability of outcome. Variability of outcome increases. If variability of the outcome increases, power decreases. More difficult to detect effects. If variability of the outcome decreases, power increases. Easier to detect effects. Decrease effect size, decrease power. More difficult to identify small effect. Increase factor, increase power. Easier to identify large effect. Significance level, decrease factor, decrease power. Stringent threshold for statistical significance. Increase factor, increase power. Lenient threshold for statistical significance.
okay.
Okay,
Next.
okay. Next,
Did it make sense, the table a little bit?
yes,
Okay.
these things like if sample size decreases, the power decreases. We know that, and the increased sample size increase, and sample size and effect size are all the same. Like if effect size is decreased, then power is also decreased because it is more difficult to identify this.
Okay.
And variability of the outcome and significance level are vice versa. Like if variability of the outcome increases, then power decreases.
Okay. Next.
and significance level. Okay. Mm, okay. Just variability of the outcome is opposite, and sample size, effect size, and significance level goes to the same direction as the factor goes. You want to add something?
No, you got it. Good.
Okay. In a clinical trial is designed A clinical trial is designed to study the effectiveness of a new treatment to lower serum triglyceride level in adults compared to the threshold treatment. The researchers determined that total 320 patients, 160 on each group, in each group 160 in each group treatment would be needed to have power 80% to detect a difference in mean serum triglyceride 25 milligram per deciliter between the groups of 0.05 significance level. At the end of the trial, the researchers reported a power 92%. Which of the following is the most likely explanation for these findings? Okay, power 92%. Have you found any clue? What they are asking for?
I'm asking
They
you, what are you asking for?
at the at the end of the trial, power is 92%, but they haven't like highlighted that is the power is increased or decreased. So what we will think? You got my point. The researcher report a power of 92%. Is the power is like increased or decreased?
So look at here. They
Okay,
said that initially they needed to have a power of 80, but they ended up having a power of 92.
92. So power increased.
Mhm. So what do you think they're asking?
As the power is increased, so they are asking for any relationship that if power is increased, sample size is increased, if power is increased, the um, effect size is also increased, and if the power is increased, the significance level is also increased. So, so smaller significance, it ruled out. The option B, the
Okay.
sample size was reduced due to attrition. This is also false because
Okay.
sample size should be increased, and the study was completed with shorter amount of time. In here, there is no time variance, so it is also eliminated. That
Okay.
option D.
Okay.
Okay, the variability of the serum triglyceride was greater than the expected variability. With variability, it is opposite. If power is increased, variability should be decreased. But in here, variability is in greater, so increase. So it is not that. So maybe option A.
Okay. I think it's option A. Let's check. You're right. It's option A. You are getting this. Oh my goodness. Okay. Let's read the explanation.
Okay, yes.
Yes.
Statistical power. Statistical power describes a study's ability to detect and affect difference between groups when only truly exist. It is the probability of correctly rejecting a false null hypothesis. Power is influenced by four interrelated factors: sample size, variability, and significance level and effect size. Larger the sample size, greater the power. Larger and in case of variability, the standard deviation of the outcome with smaller variability produced distribution are tighter around their means than outcomes with greater variability. So the difference between distribution group is easier to detect. Therefore, with other factor fixed outcome with smaller variability, outcome with smaller variability give a study greater power. So variability is inversely proportional. If variability is decreased, power will be increased. If variability is increased, power will be decreased. In case of effect size, larger the effect, larger the power size. And in case of significance level alpha, the significance in the threshold used to establish the statistical significance of the study result. The lower the significance level of the study, the more difficult is to detect the difference that might exist. Therefore, with all other factors fixed, higher significance level give a study greater power. Okay.
Mhm.
Sorry.
Got it?
Yes.
Okay, perfect. Next.
Yes. Okay. The educational objective. Power describes a study's ability to detect the effect, that is difference between the groups when one truly exists. Power is influenced by four factors: increased sample size, increased power, increased effect size, increased power, increased statistical significance, like significance level, increased power, and decreased outcome, increased power. Okay.
Okay. Next.
Yes. Sensitivity, specificity, false positive ratio, false negative ratio. Okay. Two new diagnostic tests, test A and test B, for Lyme disease, were developed by a pharmaceutical company, and their performance compared using a single population. The company reported that a greater population of the patient with Lyme disease tested positive with test A than with test B, but that a lower proportion of the patient without Lyme disease tested negative with test A than with test B. Based on this information, which of the following conclusion about the diagnostic test must be true? But patients without Lyme disease test. Is D is true?
Okay, you think it's D?
D, yes.
D as in dog. Okay. I'm between B and C though. So let's see. I'm between B and C. Let's see. Is C.
C,
Okay. I guess with the explanation. I mean, we know the table. I think we kind
yes.
of already the table. Yeah. Okay. Let's read the explanation.
Okay.
Oh,
In this example, the performance of In this example, the performance of two different diagnostic tests, test A and test B for Lyme disease are compared in single population. The patient with disease who test positive is the sensitivity of the test calculated by we know, and the false negative rate is the complement of the sensitivity one is the complement of sensitivity 1 minus sensitivity and indicates the rate of negative test results among patients with disease. A test with high sensitivity correctly identifying patients with disease as positive and has a low false negative ratio. Low rate of false negative results among patients with disease. The proportion of patients without disease who test negative is the specificity calculated as the number of the true negative divided by true negative plus false positive. Specificity equal to true negative divided by true negative plus false positive. The false positive rate is the complement of specificity. So false negative is the complement of the sensitivity, 1 minus sensitivity, and false positive is the complement of the specificity, 1 minus specificity. Indicates the rate of positive results among patients without disease. A test with high specificity has low ratio, false positive rate. Can you please explain?
okay, I'm thinking what they're trying to say is I am thinking. Here they're asking you which of the statement is true, and it matches the whatever study they did. They are saying in the study that positive, test A has a what is it? A greater proportion of patients with Lyme disease have positive test A. So test A has an increase through positive. Uh, so people that have Lyme disease tested positive with test A. So has increased, I guess I would say increased specificity. Does it make sense? A little bit.
Hmm, again,
Okay. So the question is, he says that the company reported that a greater proportion of patients with Lyme disease, so people that we know for sure have Lyme disease, tested positive test A than with test B. So test A was able to find the real people that have the Lyme disease. Does it make sense?
yes,
You just say yes, or does it make sense really?
it makes sense.
Okay. So test A was able to find. So you have Lyme disease, you test positive with test A. Whereas test B, you may have Lyme disease and you test negative. So doesn't. So test A has high sensitivity. I think that's why it wasn't making sense for you. Has high sensitivity, so it's able to find the true positives. Okay, so true positive. Now it says the next sentence. It says that, but a lower proportion of patients without Lyme disease, so people that don't have Lyme disease,
Lyme disease.
tested negative with uh, test A. So test A was not able to find that if you don't have Lyme disease, you test negative, but test B was able to find it. So test B has high specificity. Does it make sense? So it's able to find the true negatives. I don't know why this one is doing that. Does it make sense? True negatives. That's test A and that's test B. I'm giving you a second to think about it if it makes sense. Oh my God, now is a hard. Does it make sense a little
Yes.
bit? Let's do I'll say it one more time. Test A was able to find if you have the disease, it comes positive. So it's able to detect the disease, whereas test B could not do it. Then test A was not able to find if you don't have the disease, it is not able to test negative. So it doesn't tell you you're negative even if you don't have the disease, whereas test B was able to find that you don't have the disease. So test A has high sensitivity and test B has high specificity. We know sensitivity is true positive and specificity is true negative. We already know that. So now the question is asking you, based on everything that we just concluded here, which of the following conclusion is true? A, it says test A has a higher accuracy than test B. We are not talking about accuracy and
Accuracy.
precision here, so you can delete that already. Here, test A has a higher positive predictive value than test B. But positive predictive value, we know from whatever table we saw on biostats day 2 that positive predictive value goes with prevalence. And here
Yes.
they are not telling us anything about prevalence. How many people have the disease? How many people don't have the disease? We are not talking anything about that. And we also know that positive predictive value from the table that I had told that you really don't want to memorize that. Positive predictive value is positive disease over people that tested positive. Here
Yes.
we are not even talking about anything about disease or people that tested positive. This just doesn't make any sense. We are not talking about prevalence. We are not talking about people that have the disease or don't have the disease. No. Then we have C. Test A has a higher false positive rate, false positive rate than test B. If we go to our table, thank God we have our table here. Um, false positive rate will be here on the specificity. Okay.
Yes.
Yeah. So we know if specificity goes up, false
False
positive
positive
rate will
goes down.
go down. And we know that B has a high specificity,
So low
low,
false positive.
exactly. So we already know that B has a lower false positive. False positive for B is low. You just said it. Specificity is high, so false positive is low. So here is telling you, instead of telling you, they kind of play with words here. They could tell you test B has a lower false positive rate than test A. Or they can tell you test A has a higher positive rate than test B. It's the same thing. Does it make sense? They're
Yes.
just they're just playing with
Playing
the
with the
words.
words.
Instead of telling you test B has a lower false positive, which you already know, you already calculate, you already deduce here, you know, has a lower false positive rate than test A. They are telling you the opposite. Test A has a higher false positive rate, which is the same thing as saying test B has a lower one, whatever. And then D, test A has a higher specificity than test B. We already concluded here that test B has a higher specificity, so see, this doesn't even make sense. And then there is not enough information to draw the conclusion. This doesn't make sense. We have all the information that we need to. So here you just kind of needed to know that sensitivity goes with two positive and is increased here, and specificity goes with two negative and is increased in B. And then you needed to know the stable and know that specificity goes with false positive. So if this increases, this decreases, you know, just, yeah, makes a little bit of sense.
Yes.
Okay. Hope you're just not saying yes. Because I mean, I'm trying.
No, no, it
Makes
makes
sense.
sense truly.
Okay. Okay, that was next.
Okay, wait a second. Okay, p-value. Mm, a pharmaceutical company studied the efficacy of a new glucose lowering monotherapy drug for patients with type 2 diabetes mellitus. Patients with recently diagnosed type 2 diabetes mellitus were randomly assigned to receive monotherapy with either the new drug metformin for 6 weeks. The primary outcome was the difference mean glycosylated hemoglobin HbA1c at 6 months. Mean baseline HbA1c level were similar between the two groups, although both groups show significant reduction in HbA1c at 6 months. The reduction were larger. The reduction were larger in the new group than in the metformin group, minus 1.2% versus minus 0.7%. P-value is 0.02. Which of the following best describes meaning of the p-value? Okay. What is the answer?
You asking me? I'm asking you. What are they asking you?
What is Which of the following best describe the meaning of the p-value? They are asking for the meaning of the p-value. P-value 0.02, statistically significant.
They're asking you for the definition of a p. What does
P,
p-value means,
p-value
right?
means yes.
Okay, so I think this is just something you just need to know. Remember the definition. I do not remember. I think it was this one, but I'm not sure. Let's check the answer. But here it's just you have to memorize the. It's always going to be the same sentence. You just have to memorize what the p-value means. Let's check the answer. I am not sure.
Okay, you are right.
Yeah. Here you just have to memorize. Uh, it's always going to be, it's always going to start the same way. If there is no real difference between the three men, then there is a 2% chance. 2% thing comes from this. So if this was if this was 0.05, it would be a 5% chance. If this was 0.01, it would be a one,
10%.
oh, 1 or 10, whatever.
One
You
percent,
know,
sorry, 1%.
10 chance, whatever. There is a 2% chance of finding a mean A1C level difference between the groups of blah, blah, blah. That's not statistically significant. That's higher, whatever. That's not statistically significant. You just have to remember the sentence that it starts like that. If there is no difference, blah, 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 blah. There is no difference. You just have to remember that sentence. It's always going to come like that. I remember seeing something like that in your word, and yeah. Yeah. Okay, you can read the explanation.
Research studies generally compare null research study generally compare null hypothesis, that is, no difference between two group means, and an alternative hypothesis, difference between two group means. One interpretation of the p-value is that it reflects the probability of obtaining results. Difference between the two group means there that are as extreme or more extreme than greater mean. The observed results when H naught is true. The p-value can be calculated for every hypothesis. The lower the p-value, the greater the evidence of null hypothesis. The study compared mean glycosylated hemoglobin HbA1c level between patients who received a new glucose lowering monotherapy drug and patients who received metformin. Therefore, the H note in the study is that there is no real difference in mean HbA1c level between the two treatment groups. Study results showed reduction in HbA1c level of -1.2%, the new drug group, and -0.7 in the metformin group, for a difference between groups of -0.7 minus 1.2 equal to 0.5%. The hypothesis test to compare the group difference a had a p-value 0.02. Therefore, the interpretation of the p-value as follows: if there is no real difference between treatment, there is 2% chance of finding HbA1c difference in 0.05%. Okay, let's start. So, question 10.
Mm-hmm.
Okay. A 7-year-old boy is admitted to the PICU due to clinical suspicion for sepsis. The patient's parents agreed to let him participate in an ongoing clinical study to assess the utility of IL-27 in predicting bacterial infection among patients with bloodstream infection who were admitted to PICU. A blood sample is obtained and revealed IL-27 of 5 nanogram per ml. A previously published study that compared several cut points for IL-27 with positive blood culture showed that an IL-27 value more than 5 nanogram per ml has a sensitivity of 26% and has a sensitivity of 26% and a specificity of 95% in considering how this in considering how this IL-27 value might influence treatment decision. Which of the following conclusion about the study result is correct?
Mm,
Are you waiting for my answer?
yes. Sorry.
Okay, sorry. Is it B?
B as in boy or D as in
Probably
dog?
yes. B. B as in boy, not
Okay.
dog.
I think it's for me. I don't know the answer. I think it's F, but I'm not sure. Let's check because I have no idea. But you know what they're asking you. I mean, I guess you know
I
what they're asking you. Yeah.
okay.
Which one of these is true, basically, based on whatever they gave you?
Yes.
Let's see.
Okay, let's see.
You're right, is B. How did you find out? Or do you want to read or you want to explain it?
I
Explain to me.
guessed. I haven't find
Oh,
out.
you go. Oh, okay. Okay. I guess read. Please read.
Okay. Compared to blood culture and IL-27 cut point. Compared to blood culture and IL-27 cut point of 5 nanogram per ml has a sensitivity of 26% and specificity of 95%. The specificity of the test is the percentage of the individuals critically ill pediatric patients without a condition, that is bacterial bloodstream infection, who are correctly identified negative test result by the diagnostic test. Its complement its complement 100 minus specificity is the false positive rate percentage of critically ill pediatric patient without bacterial bloodstream infection who test positive. The sensitivity of the test is the percentage of the individuals, that is critically ill pediatric patients with condition of bacterial bloodstream infection who are correctly identified, that is positive test result by the diagnostic test. Its complement 100 minus sensitivity is the false negative rate, that is percentage of critically ill pediatric patient with bacterial bloodstream infection who tests negative. The specificity of 95% means that 95% of critically ill pediatric patients without bacterial bloodstream infection will be correctly identified, based on IL-27 cut point of more than 5 nanogram per ml. Conversely, 100 minus 95, 5% will be correctly identify false positive rate. The sensitivity of 26% means 26% critically ill pediatric patient with bacterial bloodstream infection will be correctly diagnosed. Test positive based on IL-27 cut point more than 5 nanogram per ml. Therefore, 100% minus 26%, 74% of patients with bacterial bloodstream infection will be missed, that is, test negative with a result less than 5 nanogram per ml. Educational objective sensitivity represents the probability that an individual with disease will have a positive test result. Specificity represents the probability that an individual without disease will have a negative test result.
Okay, makes sense.
Can you explain?
Um, let's see. They are giving you here. They are giving you specificity. What is it? They are giving you sensitivity is 26%. What is it? Yeah, sensitivity is 26%. So the opposite or the you already know sensitivity is sensitivity is too positive over
Yes, I know that.
what was it? Too positive over what?
Or true positive divided by true positive plus false negative.
Plus false negative. Okay. Ugh, my goodness. Yeah, so sensitivity goes with false negative. So if the false negative increases, the sensitivity decreases. You already know all that. So basically, that's what they're trying to tell you here. They gave you the sensitivity, which was 26. So so if the 26, the sensitivity is 26, you take the 26 out of the 100, that will give you 74, and 74 will be the false. What did you say it was?
Negative.
Sorry,
False
false.
negative.
Yeah, false negative. I don't know why my thing is being like that. Will be the false negative. So
You click
sensitivity,
you click the upper pencil one. Which
this one, but I don't know why it's always trying to make a
no
circle.
no that you should not highlight the pencil. You click the pencil. This
No,
one,
the
yeah.
pencil is highlighting, so it's not letting me. The pencil is the highlighter.
Okay, you
You see?
cannot write through this.
No, no, no. This is the writing one. This is the writing one. I don't know why it's always doing the. I don't know.
They are making
I don't know why they are always trying to make figures for some reason. Okay, whatever. But yeah, so that will be so you know the 20 100 minus 26 will be where is it? Where did we see it? I forgot where it was. Will be 74. So 74 will be the false negative.
okay.
So and remember sensitivity is the same thing as true positive. So people that tested positive for the disease and have the disease. So false negative, which is the inverse or like the opposite, will be people that they explain that to you. People that false positive, false. Well, is it false positives or false negative? I'm getting
False
confused.
negative.
It's false negative. So people that tested negative for the disease but have the disease.
Yes.
That would be the opposite. So basically, this question is just telling you that for this cutoff point that they gave you, so you kind of have to okay. So we finish with the sensitivities. This is the sensitivity. You do the same thing with the specificity. They gave you it was 95%. So 100 minus 95 will be 5%. That would be the
Yes.
false positive. You
Okay.
already know from the formula. So now you have the specificity, you know it's the true negative. So it's the people that tested negative for the disease and don't have the disease. So the opposite false positive will be people that tested positive, but um, that tested positive for the disease, but do not have the disease. So now you know the definition for all of them: sensitivity, false, whatever, false negative, false specificity, false positive. So if you go through each one based on the cutoff point, and they give you the cutoff point, critically ill patients with bacteria bloodstream infection will be correctly identified. So people with the disease that are correlating, so test positive. So that's true positive. Um, um, so that's true positive, and we know that true positive is the same thing as sensitivity.
Sensitivity.
But they're telling you sensitivity based on that cutoff point, 5% will have a sensitivity of 26%. That's what they're telling you. But here is telling you that based on that cutoff point, 5% only will have a sensitivity. The sensitivity will be 5%. Sorry. But here they are giving you sensitivity is 26%. So this is wrong. Does it make sense? A little bit.
Yes.
So you see the answer is telling you 5% of critically ill patients will have bloodstream infection and will be coronary infection. So 5% will be too positive. Will have a 5% will have sensitivity will be 5%. But this is wrong because they're already telling you sensitivity will be 26%. So this is wrong. Based on the blah blah blah. No, let's skip that one. Based on the cutoff point of 5% of 5 milligrams or whatever or more, 95% of critically ill patients with bacterial bloodstream will be correctly identified. So patients with infection will be correctly identified. Again, true positive sensitivity. Remember, sensitivity always goes with true positive.
Yes.
So 95% will be the sensitivity or the true positive. But here they are telling you on the question the sensitivity is 26%. The answer is telling you the sensitivity is 95%. So this answer is wrong. So the question is asking you to choose which of these statements is true regarding these things. So this one is false because they're already telling you sensitivity is 26.
Yes.
Based on the cutoff point, 95% of critically ill pediatric patients without the bacterial infection, so people that do not have the disease, will be incorrectly identified. Incorrectly identified.
Incorrectly.
So, so that is what? Is it
False.
true positive? Wait, is it true positive, true negative, false positive, false negative?
Now, incorrectly identified. So it is incorrectly identified. False negative.
Okay, false negative, perfect. So they're telling you false negative will be 95%. But we just calculated here that false negative was, where did we see it? We did it here. False
It
negative
is
was
74%. 74%.
74%. So you know that this is not right. And then of critically ill pediatric patients with bacterial bloodstream infections, 5% will have IL value of less than whatever, less than 5 milliliters or whatever. So people with the bloodstream, so with the disease, only 5% will have um, a false, like a negative test, because a positive test is more than 5. So negative test is this. So that is what true positive, true negative, true false positive, false negative.
Mm,
Mm,
ne-
People with the disease that have a negative result.
People with the disease. So it is false positive.
False positive, and they are telling you false positive here is 5%.
5%.
We already calculated here that the false
False
positive will
positive.
be. Mm, Wait, what is the answer? This is not right. I'm not saying it right. That's false positive. People with in disease. that have a negative value.
False.
Mm,
Specificity in 5%,
mm,
because specificity is 95%. So
mhm.
it is true positive, isn't it? 95.
So this is true positive?
Sorry, true
Okay.
negative.
Oh,
Specific.
this is what you're trying to say.
5% will have IL-27. These things I don't make sense.
This one doesn't. Let's keep this one
Okay.
instead. Of critically ill patients with bloodstream infection, so the ones that have the disease, 95% will have an IL that is less than 5, so that is negative. So that is people with the disease that test negative. So false
People with
negative.
the disease. People
Mm-hmm.
with the disease, but test is negative.
Yes, so that's false
False.
negative. Oh, that's false negative, right?
Negative. Negative. Yes, it's false
Yeah,
negative.
and they're telling you it's going to be 95%, but look at here, you already calculated false negative
Is
is
74%.
74, so this is not right. So, and then look at the answer that you gave based on the cutoff point that they gave you. 5% of critically ill patients without the disease will be incorrectly identified. So, people without the disease that test positive. So, people without the disease that test positive. That is
Pe- People without
false,
the disease.
that
Mm,
test positive. That is
False positive.
false positive. And you already calculated here that false positive is 5%, and they're telling you false positive is 5%. That's what this is the true answer. I think I remember this question. This the difference between B and E is the sentence. This says based on the cutoff point that they gave you. That's the key. Here it says
Of
out of the
all
all.
critical.
Yes, that is the difference. When you make those statements, you need to base it on whatever they gave you on the sentence. So they gave you a cutoff value of 5 milligrams or whatever thingy, not based on all the clinically pediatric patients, blah blah blah. It's based on the cutoff point that they gave you. So that's the difference between the because if you look at something else, these two kind of sound the same. These two kind of calculate the same. The rate of false positive or false whatever, I don't know, false positive. So the only difference is how the sentence is written, and it's this line based on whatever they gave you in the sentence. That's what makes a difference. Makes a little bit of sense.
Yes, yes.
Okay, at least you can eliminate all the other ones. Worst case, you'll be left with those two, but you can eliminate all the other ones. So the key here was just to find out specificity and its opposite, false positive, and then sensitivity and its opposite, false negative. Well, whatever. Yeah, false negative.
Okay.
Next. Oof. Oh, what's this again? Oh, Lord Jesus. Um,
Now the
I feel
cut.
like this one you already know. Yeah,
Yes,
this one. Yeah. We already did that one, right?
yes.
Yeah.
Let's
Yeah,
read the
you already
question.
know that false negative was the N and the N. False negative goes with sensitivity, and then the N of sensitivity goes with NPV, so they both go up and false negative. You know that. You've already seen that one. What else was he saying here? This is exactly the same thing as here. You can see it. And then the dimer cutoff. I do not remember what this was. You have to look at the video. I don't remember what this was.
Okay,
But
no
let's do
problem.
the
Let's do the
questions.
questions. So, cut off basics, public health expert trying to create an effective screening tool using test where increased value is extreme at current cutoffs, missing lots of cases. How can cutoff be changed to improve the screening ability? Screening ability. Create an
I
effective
wonder
screening tool, increase value, and in current cutoff missing lots of cases. How cutoff can be changed to improve screening ability?
I don't think you can. I mean, you can guess, but I don't think you can. Here, you have to watch that video because that was complicated even for me when I watched the video.
Okay. The,
Yeah.
then I just read the explanation and find out.
Yeah. Read the explanation. Find that. Yeah.
Okay. If screening, they are talking about screening that rules out, screening rules out. So decrease false negative, it rules out decrease false negative and increase sensitivity.
hmm
So screening increases the sensitivity, isn't it? And increase if we go opposite direction, so screening actually rules out the false negative things, and it increases the sensitivity. If we look at the thing of the sensitivity is true positive divided by true positive plus false negative. If false negative is going down, then sensitivity goes up, isn't it? So screening increases sensitivity, and increased sensitivity decreases this false negative one. Okay.
Okay. Does it make sense to you?
Yes.
Okay. I think I remember something that he said on the video, and I mean, you probably already know that for to screen for a disease, you're trying to get a test that has high sensitivity to screen for the disease.
Hmm.
Now to confirm the disease,
You need
you
high
try
specificity.
high specificity. So I think, yeah, I think that was something that he said on the video. And of course, here he's trying to screen, so he's trying to find a test that has high sensitivity. And from this, you already know high sensitivity, FN will be low, and sensitivity goes with MPV, so MPV will be high, and blah, blah, blah. You kind of already know from there. How does that work? Yeah. So,
Okay.
the key here was to know that he wants a screening test, so high sensitivity. Okay. Okay. I guess here.
Okay. How will cut off? How will cut off change depicted below impact sensitivity, specificity, positive predictive value, negative predictive value?
Okay. You tell me.
Okay. Disease. Disease, the bigger is true positive with disease. And
What are they asking you
they are asking us the sensitivity, specificity, positive predictive value, negative predictive value, the
now?
cutoffs. Like if one thing goes up, what will happen in the other thing? Isn't it? From A to B. Okay, I am doing it, then I can say you.
Okay. Okay.
Okay. Okay. In the if you write in the bigger the red one,
Mm-hmm.
the red this here you write
Mm-hmm.
it true positive. If disease is positive, write here true positive.
Okay.
And the left
Okay.
one, the disease negative, write true negative.
Okay.
So everybody keeps their last name. So In the true negative column, write false negative. The
Like
smaller is here, yes.
false negative. Uh-huh.
And the right side, you write the false positive.
False. Oh my God. I got it. False positive.
So from A to B, so false positive is increasing and false negative is decreasing. We are smashing the false negative and we are enhancing the false positive. They
Hmm.
told to go from A to B, isn't it?
From
A,
okay. Uh-huh.
yes, this direction. So false
Hmm.
positive is going up and false negative is going down. That's the thing we have found. Now, the sensitivity, according to the formula of the sensitivity, a true positive equal divided by true positive plus false negative. We have found that false negative is going down, so sensitivity is going out up. So there is increased sensitivity.
Okay.
Okay, for specificity, true negative divided by true negative plus false positive, isn't it? If false positive is going up, specificity is going down, so specificity is down.
Okay.
And for positive predictive value, PPP, false positive is going up, so PPP is going down. And for negative predictive value, NPV is going up.
MPV is going up.
Yes,
And then PPV, you say what?
going down.
Going down. Okay, let's check. Sensitivity is going up, specificity is going down, PPV is going down, MPV is going up. You got it.
Okay.
Okay. Um, I think this is just an explanation. I think. Oh, I think that he's just trying to say that if you find sensitivity, then you don't have to calculate MPV. If sensitivity, because you know they are both, well,
N
they both work the same way. You understand?
sensitivity, yes, sensitivity is negative predictive value. So sensitivity is going down, negative predictive value is going down. And
Yes.
specificity SP,
Mm-hmm.
specificity is going up, PPP is going. Okay.
Perfect. You got it. Okay, same thing here.
2 by 2 table. There is in here there is no relationship. So this is positive. This is positive, the bigger one.
The- So
True,
wait, I
true
don't.
positive.
Right? You telling me this is where here? Where do you want me to write it?
In this graph, what is happening? They are going from 1 to 2, isn't it?
Okay.
So first write the bigger one, the 1, column
Okay.
number 1, true positive,
Mm-hmm.
and the disease negative is true negative. So
Mm-hmm.
everybody keep their last name.
Mm-hmm.
So false negative,
Mm-hmm. Right
uh,
here. Sorry.
yes, yes,
False negative.
and
Uh-huh.
false positive.
False positive. Okay.
Now they are separating, isn't it? So there
Okay.
is only true negative and true positive. There is negative, false positive. So false positive and false negative is going down, isn't it?
Okay.
Okay. So if I think so,
Okay.
if we look at the sensitivity, true positive divided by true positive plus false negative. As false negative is going down, so sensitivity is going up.
Okay, sensitivity up.
And in case of specificity, as false positive is going down, so specificity will go up,
Okay.
and PPV and NPV also go up,
Yeah, both. They all go up.
probably.
Okay. Let's see. They all go up and up. Okay. You are right. They all go up. I think you got those ones.
Now the difficult one, ROC curve.
Oh, I forgot how he explained that. Let's try to do that because I forgot the video. But yeah, let's try to do the question.
A researcher is evaluating the testing characteristics of PHQ-9 screening for depression. Increase extreme. With a cutoff of 10, testing characteristics is devoted by increasing cutoff uh, devoted by an increasing cutoff of 15 will cause shift to which part? Have you get any clue? I haven't found
Do you know what they're asking you?
it. No, it's explained. I
Okay, so
completely
that's
forgot the ROC curve.
oh, okay. They ask what the question is asking you is not the question is saying that for the depression screen in the PHQ-9, that paper that they give for depression, they set a cutoff of 10. So if you have 10, then you are diagnosed with depression. Let's say like that. So this is the normal cutoff. If you answer the questions on the depression screening, they add the points. You have 10 points, yes, you're diagnosed with depression. If you have less than 10 points, then you know you don't have depression. So now this investigator is increasing the cutoff point to 15. So instead of you getting, so if you get to 10, you don't have depression. You have to get to 15 to get depression. Does it make sense?
Yes.
That okay. So now the question is asking you what will happen. So this is the cutoff point of 10 that they gave you at the beginning. So they're saying if we change that cutoff point to 15, what will happen to sensitivity and specificity?
So sensitivity will go down
Okay.
as we are increasing the cutoff,
Hmm.
like 10 to 15.
So you think if we increase the cutoff, this will go down, right? Or no? Or will it go up?
sensitivity will go down and specificity
Mhm.
will go up.
Okay. So this will go from this thing to
To
B.
B, yes.
Okay. Let's check. And you are right. You got it. That's just that's just what it is. That's the error secret. The way you can watch, I don't like the way he explains it on the video. I feel like I don't get it how he explains. He has another way to solve it on the video, but I think it makes sense to me the way I explain it to you. If you increase the
Yes.
cutoff, then it's hard for people to be diagnosed. It's harder for people to have it
Found
positive.
the case of a depression patient. Yes.
Yeah, of find the case of because you increase the cutoff. It just makes sense when you think about it. But in the video, he has kind of like another way of showing it. If you want to watch the video, you can do it. Yeah. And then what about this one?
Okay, 25K, decreasing the cutoff to 10K. So decreasing the cutoff will increase the sensitivity, but it will decrease the specifics. So it will go from uh, A point A.
Like this, you mean?
Yes.
Okay, let's check. You did not read the question. Read the question because this is wrong.
Okay, I'm sorry. Okay, you are evaluating an optimal cutoff of the diagnosis of the immune thrombocytopenic purpura, which leads to decreased platelet. A cutoff of 25K platelet leads to increased sensitivity and specific detected by, okay. Decreasing the cutoff of 10K would correspond to which point?
What are they asking you here?
Decreasing the cutoff. Okay, IT for ITP, for diagnosis of the ITP, we are putting cutoff is 25K. If the patient level of platelet is below 25K, then we are considered this patient as ITP. If we decrease the cutoff like 25 to 10K, then
Mhm.
it is harder to diagnose the ITP. So the, okay, it will go down. You have to read
Does it
the things. It
does it
may,
make
yes, it
okay?
makes sense. Like
Okay.
in PHQ, that if we increase the number of the questionnaire, then
Mhm.
it will be harder to find out or match that long questionnaire, isn't it? For this
Mhm.
patient, uh,
Mhm.
if we consider usually ITP is considered if like if, what can I say, if platelet level is below 1 lakh,
Mhm.
below 1 lakh, then we can consider is at mild thrombocytopenia or mild ITP. If we decrease the cutoff
Mhm.
like 1 lakh to 25K, that means it is harder to get. So it is B, that means it is decrease the sensitivity.
Okay. If you got it, good. If you got the explanation, good, good, good,
Yes.
good. Got it. Okay. Next.
Okay. Median 10, 20. Touch 100. True.
Oh, did you read the question? I'm sorry.
Yes.
Yeah.
Oh, so
Oh,
okay, okay, I'm reading the question.
okay. I was like, wait. Did you read the question?
Sorry. Okay, consecutive readings of pulmonary capillary wedge pressure were obtained from the patient in the ICU using Swan Gauge catheter. The readings are 20. The readings are 20 millimeter of mercury, 22 millimeter of mercury, 21, 22, 18. Which of the following is the median of the value? Median is 20.6.
Median is
Oh, no,
20.
no, no.
Oh, no.
Mean, I have found the mean. Mean is 20.6. Sorry, median. What am I doing? 20, 21, 22, 18, 21.5. So,
Okay, so which one is the median? What
median is
answer do you
21, 21.
want? Okay. You're right, it's
It,
21.
it takes so long. It is a very easy question.
It's okay. Can read the answer. Oh, you don't want to read the answer. You got it, or you want to read the answer?
I got it.
So
If you want me to read the answer, I can.
I, it's up to you. No, it's fine. It's fine for me. I don't need to read it.
Okay, then
Okay,
move ahead.
next, next. Okay.
A group of investigators is planning a study to evaluate the relationship between the serum fibrinogen level and the incidence of acute coronary syndrome. They assume that serum fibrinogen levels are normally distributed in the population of interest. Which of the following statements is most likely consistent with these assumptions? So it is normal distribution curve. So mean is equal to median. Mean median mode will be equal, isn't it?
I'm asking you. Give me the
Yes.
answer that you want me to give.
O-
What
o-
answer you want to pick?
Answer A.
Answer A. Hmm. You're right. Normal distribution, mean, median, and here is equal. It's right
Yes.
here. The answer is A. They didn't even give you an explanation. That's the explanation right here.
Yes. This is the explanation.
Yeah.
The normal distribution curve is bell-shaped, and in here, mean median mode is equal. If it is positively skewed, positive negative both skewed, mean is lower, median in the middle, and mode will be the higher.
Okay. Next.
Okay.
Mm, mhm.
A randomized control trial of a drug X is performed in adult patients hospitalized with a severe viral respiratory tract infection. Drug X has previously been shown in vitro to inhibit cell entry of specific virus. Based on a power analysis, 78 patients are enrolled in in the trial, half of whom are randomized in the intervention arm, standard care drug X, and the other half to the other half to the control standard care. The outcome of the trial is viral load in the patient's blood sample obtained by PCR measurement. The percentage of patients with a positive viral load is compared between the groups. Data from 18 patients in the intervention group and 2 patients from the control group are not included in the final data analysis because of these patients died from cardiopulmonary arrest. The results are summarized below. Percentage of patients of positive viral load by PCR, intervention group, control group, and p-value, which of when the when reporting of the result, the researcher highlight the difference in viral load after 3 days of treatment with drug X as evidence that the drug is effective. Which of the following raises the most concern about the validity of this study result? Is the option is answer?
Okay, you think it's D?
Yes, because statistically significant 0, 1, and 2. These three is statistically insignificant.
Are they asking you about the statistically significant? What are they? Is that what the question is asking you?
They are asking for the validity of the result.
Okay. Okay. So you think it's D? Okay. I think is I think it's the I think it's B for some reason. I'm not sure. I don't know the answer on this one. Decreasing trend in viral load in both groups. Yeah, I guess. I guess. I'm between A and B, but I'm going more with B. Let's see. It's B. It's B.
Okay.
Yeah, I guess let's see how they explain it. I can explain it, but I think maybe
You
let's see.
explain it in your way, then it is easy to remember.
Um, I don't know if I can explain it the right way because what you said is true. It's not statistically significant, but that doesn't. It doesn't. The question is which of the following words concern which of the following will make this study not valid. So not accurate, not valid, not good. So the fact that you are right is statistically insignificant in day 0, 1, 2. That's true. But does that make the study not valid? Maybe the drug just needs more time to work. Maybe the drug needs 5 days or something to work. And you can see on day 3 now it's statistically significant. On day 4 it's even more statistically significant. Maybe on day 5 it's going to be even more statistic. So the drug is, this is not making the whole study invalid. It just showing you that the first 2 days or three, the drug just needs more days to work. You get
Okay.
what I'm saying?
Yes.
Yeah. Yeah. And then the decreasing trend in viral load in both groups. Yes, there is less virus in both groups, so both groups are going down. So how is that making the study not good? I mean, that means the study is good because both groups are going down. I mean, this doesn't bother the validity of the study. Small number of patients in each group, in each of the two groups. No, we have, there were like 78. So 78 divided by two groups is like what, 34? I don't know. I don't remember. I'm not good in this. But there was a big, it was a normal number of patients in each group. So it's fine. I don't think that's a problem. And there is no concern about the validity there. That doesn't make sense. Obviously, they ask you what is the concern, so there should be a concern. Large number of patients lost to follow up. Look at here. So 78. Wait, what's 78 divided by 2? It's like 34. What is it?
Bro, yes,
78 divided by 2. Yeah,
34,
30. Ah, no, 39. Sorry.
39. So,
Sorry. So 39. So each group had 39. So the group with the treatment had 39. And the group with the placebo, or not the drug, whatever, placebo, I guess, had 39.
okay.
Jesus Christ, had 39. So they both started with the same amount. But look at here, at the end, 18 patients from the treatment group died. Wait, did they die? Yeah, they died. And so 18 patients here died. And whatever, two patients in the control group, so people, whatever, only two patients died. So even if at the end we have a statistically significant thing, so we can say, oh, the treatment is curing people, so whatever. So look at day 4, there is less people with viral load in the treatment group, so the treatment is good. There is 18 people that died.
Died.
So maybe the treatment is good, but the adverse effect, the side effect of the treatment are not that good because a lot of people are dying. You see what I'm saying?
Yes.
You see, yeah. I think that's what they're trying to come up here. Like a large number of, there is a large number of patients that died, that were lost to follow up. So maybe that's causing something with the validity of the study. Because the researchers concluded that, oh, our treatment is good. Look at day 4. There is only 3 people
Three
that have
people.
virus. So they're saying, oh, and it's statistically significant. So our treatment is really good. We can put it on the market. But then you see 18 people die from this 30, and only 2 people die here. So maybe your treatment has really bad side effects that kill people, and that will go against the validity or the significance or whatever of the study. I think that's how I took it. Does it make a little bit of sense?
Yes.
Okay, now I read the explanation.
Okay. Next. Confidence.
Oh, I thought you were going to read. You don't want to
Oh,
read the
oh,
explanation?
no, no. I will read the explanation. I thought that we have completed the explanation. Okay. The study evaluated the effectiveness of drug X in adult patients hospitalized with a severe viral respiratory tract infection. The results of the study showed a trend toward decreasing viral load in both groups, and the group difference was statistically significant after the second day. P-value less than 0.05 starting on day 3. The researchers highlighted that as time progressed, patients receiving drug X had a significantly lower viral load than those with the standard care. However, 18 patients, 46% of 39 patients receiving standard care plus drug X, and 2 patients, 5% of the 39 5% of 39 patients receiving only standard care were not included in the final data analysis due to death from cardiopulmonary arrest. The differential loss to follow-up is concerning. It may be related to the exposure drug X, suggesting that drug X may increase the likelihood of death. Difference between the two groups are possible but less likely given the randomization process. In this case, researchers reported the significant difference in viral load between groups but did not acknowledge the relatively large groups of death among patients receiving drug X, thus introducing bias favoring drug X. Differential loss to follow-up is a subtype of selection bias and represents a threat to the internal validity of the study. Okay.
Mhm. Okay, we are halfway. Can we take a break so I can
Yes,
check my
yes.
yes, yeah, I can check my brain.
Okay, confidence interval. Uh, the administration. The administration of a university hospital conducted a cross-sectional study of errors in the medication use process across all hospital environment. The medication use process MUP across all hospital. The MUP incorporates a wide variety of scenarios including timing error, dosing error, adverse event. The result of the study showed that in a random sample, 360 patients receiving treatment in the emergency department, and the prevalence of the medication use process MUP errors is 32.7%, 95% confidence interval, 24.3 minus 24.3 to 41.4. The director of the emergency department had previously reported that the prevalence of medication error was approximately 25%. Based on these data, which of the following conclusion is most appropriate? Okay, are you waiting for my answer?
Yes,
Mm, is it B? Boy?
B as in boy.
Yes.
I think it is a study can evaluate statistical hypothesis because it's a. I think it's C. Let's see. This cannot evaluate. Let me put at the prevalence. Yeah, it's just prevalence. So it's probably okay. Let's see. Oh, what is the answer?
They haven't given.
Uh, wait. I don't know.
Answer C, 71%.
Oh, you think that's the okay? I know it's not A because A is here on the answer choice, so it's not A. Yeah, I guess it's C. Let's read this. Read the explanation. Let's see. I think it's C.
A confidence interval is a range of plausible values calculated from the sample data that captures the true population value with a confidence level. This means that true population value could be any value in the confidence interval. Therefore, confidence interval offers the necessary information to evaluate whether there is statistical evidence in favor of in favor of or against a claim about the true population value. In this case, the prevalence of errors in the medication use process is estimated at 32.7%, but it could be any value between 24.3 and 41.4 at a 95% confidence interval due to a sampling variation. Because confidence interval 24.3 minus 41.4 includes 25%, that is the director's race reported prevalence. It is possible that the real prevalence of medication error is 25%. Therefore, results do not contradict the director.
Do you understand? Makes
No.
sense? Oh, they're just saying that they did the study and they found 32% error, 32%, 32.7% error, which is you can see the confidence interval is inside the confidence interval. So, and the confidence interval doesn't include one, so it is statistically significant. Makes sense right here, right?
Yes, yes,
Okay. But they're saying that they had previously asked the director of the emergency, and the director had said that the error was 25%. So they are asking you, um, what is why did the director say 25% error, but then they did the study and it's 32% error? Kind of like they're asking of what does that mean? But they're telling you this doesn't mean anything because the 25% is still inside this interval, 24 to 41.
yes,
And there is still no one, so it's still statistically significant, right?
yes,
Yeah. So they're basically saying if whatever value that's between 24 to 41 can be the number of errors.
yes.
Does it make sense? And it can still be
Yes,
statistically significant.
it
Yeah.
makes sense.
Yeah. That's kind of what they're saying. So the director didn't lie. He didn't do anything wrong because his thing is still statistically significant. It's still within the interval. Okay.
Okay.
Okay. Next.
A group of epidemiologists studies tinnitus and various possible factors associated with the condition in a representative sample of the adult population in a particular city in the US. The data collected in the study represent the civilian, non-institutionalized population in the study using stratified multi-stage cluster random sampling based on the census data. A total 2645 adults aged 21 to 98 were invited to participate, 91% of whom completed the study. Data on the presence of tinnitus as well as the personal socioeconomic autologic factors were collected. Results showed that age, gender, stress status as a soldier, hearing loss, noise exposure with earphones, noise exposure at workplace, noise exposure at locations other than the workplace, and brief noise exposure are associated with the tinnitus. Which of the following best describe this study design? Data is random sample, isn't it? So is it RCT?
So you think it's E?
Yes.
Okay. Because you cannot I'm not saying it's not the answer. It may be the answer. I don't remember what's the answer. But you did that yesterday, not because you see random, that automatically means RCT.
Yes.
You did it yesterday too. So it's like when you see the word random, you just automatically go to RCT. No, we kind of want all the study designs to have a random thing. It's not it's not because it's random that it automatically means, oh, we did RCT because it's random. We kind of want all of them to have a random selection of whatever. Um, I think I think it's cross sectional because they didn't follow up the patients. They didn't. I guess, yeah, there is no like exposure and outcome. There is no outcome and exposure. They just found people on the street and asked them, "Hey, do you have tinnitus? And then, did you work in the military? What is your age? Blah blah blah." I think so. I think it's cross sectional. Let's see. It's cross sectional.
Yes,
Does it make sense a little
yes,
bit? Okay.
makes sense actually.
So, you read the spelling.
Okay. A cross-sectional is an observational study that is used to estimate prevalence of the disease because it may be used to examine the association between the risk factor and the disease in a well-defined population at one particular type. This type of study, this type of study typically takes a snapshot of a population and measure the frequency of risk factor and disease simultaneously. In this study, participants are participants are classified according to the risk factor, age, gender, stress, hearing loss, and the disease status, and the presence or absence of tinnitus. At the same time, snapshot. Then the association between the factor and the disease is evaluated. A major limitation of cross-sectional study is the temporal relationship between the risk factor and disease is not always clear.
Makes sense.
Yes.
Okay.
Okay. Sensitivity specificity. In a in clinical practice, the cage questionnaire is used to screen patients for alcohol use disorder. Replies when a patient replies with 2 out of 4 positive responses to the cage questionnaire, the test is considered to be positive for alcohol use disorder if the criterion is changed so that 3 out of 4 positive responses to the cage questions label the patient as having alcohol use disorder. What is the effect of sensitivity and the specificity of the disease? 2 out of 4 positive responses. 3 out of like increase sensitivity. We are increasing on the criterion value. Initially it was 2, now it is 3. So their sensitivity will decrease, isn't it? Because as we are taking more and more criterion, so sensitivity will increase and sensitivity will decrease. Sensitivity will sensitivity will decrease, but specificity will increase. See, Yes.
You are right. I think you kind of already
Mm,
got this
yes.
caught up. Perfect.
Okay, next.
Next.
A study was conducted to assess the A study was conducted to assess the association between HRT in postmenopausal and the level of serum C-reactive protein categorized as high or normal based predefined values. The data from the study. Which of the following is the best statistical method to assess the association between HRT and CRP level? Is it t-test?
You think it's the test? You want me to mark the test?
Yes.
I think it's chi-square.
Categorical.
Let's see. It is chi-square. Do you get why?
They are categorized this patient between HRT and CRP level, and they are categorization based on high or normal. It is t-test is the like mean value, like the numbers, but the
Mm-hmm.
chi one is the category high low. It is not the number.
Yeah, you got it. You got it. You can read the explanation. Yes. But yeah, yeah, now you got it. Yeah.
So chi square is used to compare the proportions of a categorized outcome with qualitative, categorical, and independent variable, and a qualitative, categorical, dependent variable. Qualitative, categorical, independent variable, and qualitative, categorical, dependent variable. In this case, the outcome of the CRP level is categorized as either high or normal, and then presented with the categorized exposure HRT and no HRT in a 2 by 2 table. In one of the commonly used chi-square tests, the observed value in each of the cells are compared to expected under the hypothesis of no association value. If the difference between the observed and the expected value is large, an association between exposure and the outcome is assumed to be present. Okay.
Okay. Next.
And a study was conducted to evaluate the efficacy. A study was conducted to evaluate the efficacy of a new antiviral drug for treatment of the common cold of the young children. The study population consisted The study population consisted of 100 children between the age 2 to 8 years. These children were diagnosed with rhinovirus infection and subsequently given the particular antiviral drug. 1 week later, it was observed that 92 of the 100 92 of the 100 patients were asymptomatic. Which of the following is the true conclusion of this study? Okay, what is your answer?
What is your answer?
Uh,
What are they
okay,
asking you? Oh, okay. You wanted to give me what is your answer? Sorry.
they're asking to find out the true conclusion.
Okay. Do you have an idea? Can you eliminate something maybe? Or do you want to?
Initially, the study uh, later it is observed 92 out of 100.
Mm-hmm.
92 out of 100 patient is asymptomatic. Usually,
Mm-hmm.
the drug is highly. Okay, okay. Okay, it is answer C.
Okay.
Because
Can you tell
yes,
me what?
yes, because we know that common cold is a self-limiting disease, and
Mm-hmm.
it will like it will fall down or the disease will recover within 1 week. So
Mm-hmm.
they in this study they have seen that 1 week later 92 out of 100 patients are asymptomatic, and we are
Mm-hmm.
thinking that these antiviral drug has done something great,
Mm-hmm.
but it is
Mm-hmm.
not because of the antiviral drug, it is because of the disease nature of the disease.
Perfect. Perfect. You got it.
Okay,
You can read the explanation.
okay, you want me to read the explanation?
Up to you.
Okay, let's move forward.
Okay.
Attributable risk percentage ARP. A cohort study was conducted to assess the relationship between high saturated fat consumption and the occurrence of the colorectal cancer among women. A group of women aged 40 to 65 was selected. The baseline the baseline saturated fat consumption was calculated using a food questionnaire, and the cohort was followed for 7 years for the development of colon cancer. The study showed that the women with high baseline saturated fat consumption have 4 times the risk of colorectal cancer in a 7-year period compared to women with low fat consumption. Relative risk 4, 95% confidence interval 1.5 into 6.5. According to the study result, what percent of the colorectal carcinoma in women with high fat consumption could be attributed to their diet? So, what is the equation of ARP? Attributable risk percent.
You have two. You have one that is risk in the exposed minus risk in the unexposed over risk in the exposed. And you have a second one that's relative risk minus 1 over relative risk.
So, two equation. So relative risk minus 1 divided by relative risk. So 4 minus 1 divided by 4. 3 by 4 into 100 for 25. So it is 75.
Okay, let's check. Yep, it's 75. So here you just needed to know the formula.
Relative
This
risk
is
minus 1 divided by relative risk.
or also this one.
Hmm. Okay,
Got it?
yes.
Next. Next.
Okay, a new multi-drug chemotherapy regimen significantly prolongs the survival with lung cancer if this new regimen is widely implemented. What changes the prevalence and the incidence of the lung cancer would happen? Mm, Incidence will not gonna change, but prevalence will increase. If we use a new drug, we cannot control the incidence, isn't it? But as the new drug is a game changer, so more and more patients will live and prevalence will increase.
So what's your answer?
So incidence will not change, prevalence. C,
Okay.
cow, cow.
Yes, you got it.
Okay,
Do you want to read the explanation?
no.
I guess it's me. Okay.
You want me to read the explanation?
Oh, yeah, read
Okay.
it. Mhm.
It is important to understand the difference between the prevalence and the incidence. The two basic measure of the disease occurrence. Incidence is the measure of new disease, the rapidly with which they are diagnosed. Prevalence is the measure of total number of the cases at a particular point of time. Incidence answers the questions how many new cases of the disease developed in a population during a particular period of time. Prevalence answers the questions how many cases of the disease exist in a population at a particular point of time. The relationship between the prevalence and the incidence can be expressed as prevalence is incidence into time. The incidence of a disease is not changed by any kind of treatment because the disease has already occurred when treatment is started. On the other hand, the prevalence may be affected by treatment of the disease. In this case, treatment of an acute and rapidly fatal disease, lung cancer, prolonged the survival of the patient. However, such treatment did not cure the disease. That will result in more people the having the said disease at one point in a time. Hence, the prevalence will increase.
Right.
Okay.
Next.
A group of interventional cardiologists conducted a randomized control trial to determine whether telemonitoring has an effect. Telemonitoring has an effect on heart failure. Telemonitoring has an effect on heart failure outcomes among patients recently hospitalized for heart failure. A sample of 1653 patients hospitalized for heart failure in the previous 30 days was randomly assigned to receive usual care or undergo telemonitoring according to the sequence of computer generated random numbers. The primary endpoint was a composite of readmission for any reason or death from any cause within 180 days after enrollment. A committee of the physician, all unaware of the treatment group assignment, adjudicated each potential readmission to ensure that the event qualified as readmission. and not another clinical encounter such as emergency department visit, and to determine the primary care readmission. An excerpt of the study result shows. Telemonitoring problem. Which of the following statistical test is adequate to determine whether telemonitoring affects heart failure outcomes among patients with a recently hospitalized heart telemonitoring effects? Okay, have you found the clue to diagnose this?
Hmm, I don't know if there is a clue, but I'm between two answers. What is your answer?
Is it uh, correlation analysis?
Okay, you think it's correlation analysis. Why?
They are looking for the relation between the heart failure based on telemonitoring outcome and on recently hospital especially. That's why they are trying to correlate something.
Okay, so um, okay, so correlation analysis is the one. So what are you going to correlate here? So correlation analysis is the negative one, negative plus one, whatever. So what will be your correlation analysis here? What will be your 2 points?
Heart failure and without heart failure.
Heart failure and without heart failure. And what would be the other one? The other, so X will be heart, let's say it will be heart failure and no heart failure, I guess. What would be the X? Why would be heart failure without heart failure? What would be X?
No, there is no X. Is there?
I'm asking you, you the one that says it's correlation analysis.
Okay, it's not then correlation analysis.
Do you understand what they're asking you?
Trying to understand.
Okay. I think you understand what they're asking you, I think. But I think you cannot, from what I think you cannot determine what are your two groups.
Yes.
So what are the two things you're comparing? So I think that's where you need to start. What are the two things you're comparing?
We are like telemonitoring and usual clear care.
Telemonitoring and usual care. So that's one group.
Yes.
What's the other group?
Heart failure and without heart failure.
Where do you come heart failure without heart failure? Where? Uh, there is no without heart failure. They are only doing people with heart failure. What do you see without heart failure here on the
Okay,
question?
no.
So you say one group was this one.
This one, telemonitoring and usual clear care.
Mm-hmm. What's the other group?
There is no other group.
Okay. They kind of gave you the table. So in the
Yes.
table, they say they are comparing telemonitoring and usual care versus the
Oh, death or readmission.
exactly. They are already giving you the table to give you the two groups.
It is written in such a manner.
Yeah, I know. Yeah, it is. That's true. That's true. It's written in such a manner. So now now what is next? We're trying to find out. So you already say it's not correlation analysis. Fine.
Yes. It is not
Uh,
meta-analysis also.
it's not meta-analysis.
It
What
is
else can
not
you eliminate?
t-test.
Okay. What else can you eliminate?
It is not tree, ANOVA, analysis of
Not
variance.
really ANOVA because we only have two groups. So
I
now we have between chi-square and t-test.
so
What was the
it is
difference between them?
categorical like death and readmission.
Okay, why do you say it's categorical?
Why I say it is categorical? No, it's to t-test. I think so.
Why do
No,
you
it
say
okay. It's categorical. Now
okay,
my
what do
answer
you
is
say?
fixed. Okay,
What is
it is categorical because in categorical we are we do not deal with the mean. We deal with the category that in here the primary endpoint death versus readmission based on the telemonitoring or usual care. So we categorized the patient into telemonitoring and the usual care. We are not looking at the number like the means. The telemonitoring is 432 and usual care is 426. We are not concerned about that. We are concerned about the uh, telemonitoring and usual care. That's why it is sky. Makes sense.
okay? Let's look at the answer.
I don't know
So
uh,
mhm.
how I thought. Am I in the right direction or am
I
I
think you
floating in the air?
no, you are. I think you just have to always try to figure out the both groups. This is one group, this is two group, the other group. Now each group, you already know chi-square. In chi-square, both groups are going to be categorical. So here you are measuring the death and readmission. Is there any numbers? No, you're just measuring is he dead or is he readmitted. That's it. There's no numbers. Here, the second group, you're just measuring telemonitoring or usual care. There is no numbers. There is no okay telemonitoring for 5 hours, usual care for 2 hours. Nothing. It's just both of them are categorical. So it's chi-square. If it was this t-test, it will say okay, maybe here um, telemonitoring and usual care. That will be one group. The second group will be um, mean of the death or whatever. I don't know how many people died. 5 people. How many people were admitted? 15 people. So one of them will have whatever. Will have a number. So in chi-square, both groups need to be categorical. In t-test, you are comparing the mean between the two groups. Now, the two groups, one can be categorical, the other one can be numerical, whatever. But the key is to know, you need to first know which ones are your two groups. Does it
Okay.
make sense a little
Yes,
bit?
makes sense.
Okay, I guess you can read the objective, the educational objective.
A chi-square test evaluates the relationship between two categorical values, two categorical variables. It requires a categorical independent variable exclusion and intervention that is used to divide the study participants into two groups and a categorical dependent variable, the outcome. Okay.
Okay, next. Oops.
True cross-sectional studies were conducted using different questionnaire. to determine the prevalence of over-the-counter analgesic use in a population. The first study showed a prevalence 7.5%, 95% confidence interval 6 to 9. The second study demonstrated the prevalence of 7.3% confidence interval 6.9 to 7.6. If the true prevalence of over-the-counter analgesic use the population is 7.4, which of the following statement about the result of this study is most accurate? What they are asking for, which of the study is more accurate? Accuracy. If we go closer to the true prevalence, like 7.4, what will happen if we go closer 7.3? Second study. Is it question answer E? In the second study, results are more precise.
I have no idea on this one, but you think it's E.
Yes,
Okay, let's check. You are right. Can you explain me why?
I am 7.4 is the like it is we for disease for precision and accuracy. If the mean is, we know that precision like 7.4 is the mean, isn't it? So prevalence is 7.3 and prevalence is 7.5. If we put these three things side by side, 7.3, 7.4, and 7.5, I think that 7.3 is more precise. Like, what can I say? I can't explain that, but
Okay,
I guessed.
okay. I mean, if you understand it yourself, it's fine. It's okay. You want to read the educational objective?
So how you find it out?
No, I didn't find it out. I had no idea. I didn't know. That's why I'm asking you. I asked you to tell me how you found it. Yeah.
Okay. Precision is the measure of random error. The tighter the confidence interval, the more precise the result.
Okay.
Okay,
Right. So
look at the prevalence of the 7.3. The confidence interval,
mm-hmm.
it is more tighter, 6.9 to 7.6, and
Mm-hmm.
the prevalence falls in the 7.3. So it is more tighter, isn't it? And
Mm-hmm.
look at the first study where it is in between 6 to 9. So it has like wider Uh,
Mm-hmm.
so it does not have any tighter confidence interval. It has wider confidence interval, so it is less precise.
Got it.
Okay.
Got it. Got it. Got it. Next.
A university hospital conducted a study to determine the effect of type of attending physician supervision of inpatient resident on patient safety and educational outcome. 50 attending physicians provided either increased direct supervision, in which attending physician joined rounds on previously attended patient, or standard supervision, in which attending physicians were able attending physicians were available but did not join the patient round. Residents then randomly assigned to either type of the attending physician. One of the outcomes studied was total were randomly assigned to either type of physician supervision. One of the outcomes studied were total duration of the rounds measured in the minutes. Which of the following statistical tests is adequate to determine whether type of the attending physician supervision has an effect on the average of the duration of work rounds or resident? Is it correlation analysis?
Okay, you think it's correlation analysis. Why?
They are There is no specific exposure and outcome. It is not the t-test, isn't it? Independent sample t-test. It is not chi-square, because we haven't found two categories of people.
Okay, so you want. What are your two groups? What are the two things you're comparing?
That there is no such two things to compare.
What do you? So how do you say is correlation and you to be correlation analysis
We,
or
we need
t-test or
to
type, you need to have you must
must
have two things to compare. So what are the two things? That's always the first thing you need to find.
50% direct supervision and standard supervision. One thing.
Okay, that's one thing. Direct versus standard. Okay,
Yes.
one group. Uh-huh. What's the other group?
Uh, Rounds measure total duration of patient rounds measured in the
Okay, so rounds duration, measured in minutes.
minutes.
That's
Yes,
the key. Measured in
in
minutes.
minutes.
Okay, so now you have your two groups. So
Yes.
can you eliminate something?
So if it is two groups, Then it is not correlation analysis.
Why?
Oh, no, no, no. I'm talking. If it is two groups, then it is not t-test because they are not talking about the mean. Am I right?
Why? I want you to give me an answer. I'm going to keep asking you. I'm not saying you're wrong or you're right. I just
Okay.
want you to tell me why you pick whatever you're picking.
Correlation analysis comes with the exposure and the outcome, isn't it?
Uh,
Or I'm thinking in the wrong direction.
do you are thinking? Do you want me to pull up
The
that table? Wait, let me pull up that table so you can see it. Where was that correlation?
okay, I am talking about cross section, not correlation.
Yes, I think you are mixing up two different tables. Was it day two? I guess maybe it was day two because I don't see it in day one. Day two, where is it? Where is day two? Ah,
Biostat 2,
yeah, day two. Ah, never mind. Let me go to biostat. I didn't want to do it like that, but fine. I'll just do it like that. Wait, am I missing something? Oh no, it's Dr. Manan here. Biostats. Day two. Okay, you are confusing that cross-sectional table with this. Was it not? Was not this one? Am I missing something? There was a table for that, right? I'm not missing it. I'm
we
not
have
making it. I'm
we
not
have
making it up, right? I'm not, I know. I mean, oh, but there it is. There it is. I was like, I'm not making it. I know there is a table for that.
yes.
Okay. Okay.
Correlation is established how x and y are related. Okay, comparing the continuous, yes.
Mhm. So we have two groups.
Okay,
Okay, one is in minutes number, the other one is, I guess we'll say categorical because it's direct supervision and not direct supervision.
supervision.
So is there something you can eliminate already from that here, from the questions, from the answers? Okay,
Yes, it
which one? Which one can
is
you already eliminate? Which
it
one
is
can you?
not meta-analysis. It is not
Okay,
t-test.
okay, let's think about it again.
Okay,
Chi-square, we said that chi-square was
categorical,
both groups are supposed to be categorical.
categorical. There is
So here are both groups categorical?
no.
No. So can we eliminate chi-square?
Yes.
Are you just saying yes
No,
because
no,
or
no, no.
you
I
get
am
it? Okay, you
asking
get
yes.
it. Okay. So we are left with correlation analysis and independent t-test. Correlation analysis. Usually correlation analysis, we have two. Hmm, I think, for example, I think it's t-test because usually correlation analysis, you have two numerical groups, so two numbers, and you calculate, you put them each in x and y, and then you calculate as one goes up, as the other one goes down.
Go down, go.
So
Yes.
usually it's two
Two.
quantitative groups, two numbers.
Yes.
So that's what I think is t-test because t-test you compare. T-test doesn't always have to be the mean. Let me. Okay, I think we saw the table and you saw mean there, and you think that t-test always have to be the mean. It doesn't have to be the mean. It just has to be a number. So the person just took mean as an example that okay, mean are usually numbers, but it just has to be a number. It does not have to be the mean specifically. I think that may have confused you because you saw on the table here it said mean, and you just assume, okay, always have to be mean. It's always have to be a number. Mean is usually a number. That's why they say they took mean as an example. So I think it's the test. Let me check before I give you the wrong answer. Yeah, it's the test. So remember correlation. I think you're good in chi-square and meta-analysis. You're good. You know why it's not that. So I don't have to go over that. Correlation analysis, both group have to be numbers. So this one and this one have to be numbers. Chi-square, both group has to be what?
Categorical.
Categorical. Perfect. Independent test, that's the one that's shaky. So one group can be numbers, one group can be can be categorical, whatever. But so that's why I think it's better to just make sure it's not chi-square, it's not correlation, and then you're just left with whatever it is. Makes sense a little bit.
Yes.
Okay, because I don't think there is no explanation from that one. Okay, next one is kind of the same thing. So let's see.
Okay, next. A study is conducted to determine the mean level of the total serum cholesterol in patients with acute pulmonary syndrome. A 2,500 randomly selected patient participated in this study. One of the study goals is to compare the mean level of the total serum cholesterol between male and female with acute coronary syndrome. Results showed that the mean total cholesterol level 230 mg per deciliter male and 220 mg per dl female. Which of the following is the most appropriate statistical test to determine whether the difference is the mean cholesterol level between male and female patient with ACS? It is t-test, isn't it?
Why?
In here there is a number, mm, and difference the mean in the cholesterol level, male and female. Okay.
What are your two groups?
To male and female, one group,
Male and female, one group. Okay.
and total cholesterol, mean
Total. Mean.
total cholesterol.
Mm-hmm. 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 So can you eliminate based on the two groups? Can you eliminate something?
Yes,
Okay.
it is not correlation, it is not logistic regression, meta-analysis, these three.
Why
And
is it not correlation?
it is not. These three rules out, yes.
Why is not correlation?
Correlation analysis is one, like one goes up and one goes down.
Okay, got it. Why is it not regression?
There is no like, don't know why it is not regression.
Okay, okay. You just okay. Why is it okay? So you are left with chi-square and t-test. Which one do you think it is?
They are actually comparing with the mean, so it may be t-test.
Why is it not chi-square?
They are not categorizing anything. That's why.
Okay.
Am I right?
I don't know if that's what you're trying to say, but you are looking at both groups. This group is category and this group is numbers.
Okay.
So for chi-square, both group needs
Both
to be
groups should be categorical.
category. Okay. So I think it's t-test. Let's see. Yep, it's t-test. You're right. Mm,
Okay.
mm, yeah.
Next.
Okay. Oh, next. Okay, you want to go next. Okay. Next.
Okay. A new rapid diagnostic test for respiratory infection is evaluated. How many questions left? Are we
We
about
are
to finish
no,
today?
I don't think so because we are 29 and it goes to 43.
Okay, then we should leave now.
Okay, let's leave
Okay,
now. I'll see you tomorrow.
okay, bye bye.